So seeing is believing. If you look at the photo on the right there, can you believe the burden of disease that's been created on this woman for the treatment to undergo surgery to remove their breast for breast cancer treatment? So 1 in 8 women in Australia will be diagnosed with breast cancer in their lifetime. As genetic testings like BRCA1 and 2 becomes more available, more and more women will be diagnosed early, and evidences show that more and more women are opting for aggressive surgery early on to achieve cure. So looking at the picture on your right, what you can see is you can appreciate how breast reconstruction to replenish the volume that you've just lost has become an important component of the holistic treatment of breast cancer. So for breast reconstruction, surgeons most commonly use the tummy fat, because let's face it, we all have plenty of that. And also it has a simultaneous tummy tuck-like effect to the donor site. So the tricky part though is, this fat needs to be lifted off as a free flap based on 1 or 2 dominant blood vessels called the perforators to survive. These perforators are found underneath the fat, courses through the muscle that we know of as six packs, and goes down right into your groin. However, everybody's perforators are made different, so everybody gets a CT scan before the surgery. Now, if seeing was believing, then touching and seeing, so was it a bit creepy, I think? Touching and seeing is a game changer. Unless you've been living in a cave for the last decade or so, you've probably heard that 3D printing has been touted as the most disruptive technological advancement of the last decade. So in the operating theatre, the biggest challenge is for the surgeons to differentiate the perforators from the surrounding six packs, because they all look the same. They're both red and translucent. So in our research department, we've developed an affordable and convenient method of 3D printing using free open source softwares and Officeworks 3D printers. So converting the CT data into a 3D printed model of a perforator in red and the surrounding six packs in transparent plastic, our early research findings show that it can help surgeons to plan and design these free flaps much more intuitively. And we can also use this for surgical simulation and for patient education. This has been Michael Chae from the School of Clinical Sciences. Thank you very much for listening.